Hi, I'm Vicky Eghan. I'm a children's nursing student studying at Buckinghamshire University and I live in North West London. I chose to do nursing because I've always wanted to help people, and nursing is one of those professions where that is all you do, you help people. And I'd love to look after young children, hence why I chose children's nursing. Just wanting to make a difference in their life, promote health and help them to be the best they can be and get the best quality of life. The mannequins and sim babies in the simulation lab are really high tech and enable us as students to practice our skills before we go out into practice. Our lecturers can enable them to make a sound, breathe, in order for us to carry out our assessment and make sure we know what we're doing for when we go out into practice. At Buckinghamshire University, they split the course into 6-month blocks. So for the first 6 months is theory-based. So we're on campus for 2 days and the rest is self-guided learning. We learn our clinical skills in the simulation labs ready to prepare us for practice. And then the other side is research-based, as nursing is evidence-based from previous research, because without having the research you wouldn't know if anything would work or not. So we have to do that and then work on public health skills and promoting health within nursing. During my first year of nursing, I was placed on a general children's ward, which I really enjoyed. I was there for 10 weeks. I learned a lot whilst there, including baseline observations. I found it hard to take a child's temperature, but with practice I developed the confidence to do this and I was able to carry out these observations quite quickly. I developed skills in talking to patients and their families, as children's nursing is not just the child, you have to take into account the whole family, the parents and their siblings. It's holistic care. My second placement, I was placed on an adult insight ward, because even though I am studying children's nursing, we come across adults who are the family members and we have to be prepared in case something happens with them and know what to do. I then had a learning disabilities placement in a school for 4 weeks, which I absolutely loved. It made me miss my old job and I did question whether nursing was for me after that placement, but then I realised I just needed to carry on through the course and then I could go back into that field and work with children with special needs once qualified. And I've had a recent placement in an orthopaedic ward where there's lots of spinal surgery, so I was able to go into theatre and observe many different types of surgery, which was really interesting.
Click the videos to watch more Londoners and don't forget to subscribe.